In 2011, Kobe Bryant flew 5,000 miles to Germany for a treatment made out of nothing but his own blood. He could not legally have done it at home. 2 years later, at 34, he finished third in the NBA in scoring and led the league in minutes played. The doctor is Peter Wehling, a molecular orthopedist in Düsseldorf. The Los Angeles Times broke it in June of 2011. Bryant was 32, 3 operations already on that right knee. Then he sent Alex Rodriguez, then Andrew Bynum went. The same doctor had reportedly treated Pope John Paul II. So why does a man have to cross an ocean to get his own blood put back in his knee? The obvious answer is the one everybody gave. Europe is looser, and rich athletes buy access ordinary patients do not get. True in general, not what happened here. But here's the detail nobody tells you. There was no German drug. Nothing was waiting on a shelf in Düsseldorf. It was not stem cells. It was not platelet-rich plasma either, which is what most of the coverage called it. They drew his blood into a syringe lined with medical-grade glass beads and held it at body temperature for hours. White cells touching that glass produce interleukin-1 receptor antagonist, the body's own brake on the most destructive signal in an arthritic joint. Then you spin it, keep the serum, put it back. The trial behind it randomized 376 knee patients against hyaluronic acid and against saline, blinded. The serum arm did better on pain and function. He did not fly 5,000 miles for a drug. He flew for a definition. The FDA lets you put your own tissue back if it is minimally manipulated. Warming blood for hours to change what is in it is not minimal. Cross that line, and what comes out of the centrifuge is legally a new drug, and it needs an approval nobody had filed for. Same blood, same syringe, same doctor, different side of one sentence. The frontier does not usually move because somebody discovers something. It moves because somebody rewrites where that line falls. If you have ever felt that the interesting things are always happening somewhere else, this is why. Now, the part that keeps me honest. That trial came out of Germany with a company that sells is involved in, and the treatment group got twice as many injections as the controls, which matters, when the endpoint is pain. When that protein was purified into an actual drug and tested on its own, it failed against placebo. And nobody can tell you this is why he played the way he did at 34. I mean, one man is never evidence. That last part lands in my own industry, which leaves the question I keep turning over. If a sentence in a regulation is what kept it out, what else is sitting on the wrong side of that line? My name is Ricardo Barreto, and I travel the world in search of the companies, people, and technologies paving the path for the future of medicine. Follow for more. Don't miss out on the next one.